This video provides an overview of the autonomic nervous system from an anatomy perspective. As we wade into the waters of the autonomic nervous system, I first want to discuss a few basic concepts. The nervous system is divided into both the central and peripheral nervous system. Specifically, the central nervous system contains the brain and the spinal cord. Both of these structures are derived from the neural tube, which develops in the third week of gestation. The peripheral nervous system, however, develops from neural crest cells. Anatomically speaking, the peripheral nervous system is divided into spinal nerves, of which there are 31 pairs, and cranial nerves, which have 12 pairs. Spinal nerves originate from the spinal cord and they exit the vertebral column via the intervertebral foramina. Cranial nerves, however, mostly originate from the brainstem and they exit the cranium through foramina in the floor of the skull. The peripheral nervous system is also divided functionally into somatic and autonomic divisions. Autonomic fibers are further subdivided into parasympathetics and sympathetics. Regarding the somatic system, somatic nerves come in two flavors. The first flavor of somatic neurons that we'll discuss are general somatic afferent fibers, abbreviated GSA. These fibers transmit sensations from the body back to the central nervous system. These sensations can be in the form of exteroceptive fibers, meaning that information is conveyed from the skin about pain, touch, vibration, temperature, and even pressure. Sensations can also come in the form of proprioceptive fibers, meaning that information from muscles, joints, and tendons is conveyed back to the central nervous system concerning joint position and the tension of the tendons and the muscles themselves. Say, for example, that I closed my eyes and I placed my hand behind my head. I know where my hand is positioned in space relative to my other body structures thanks to my proprioceptive fibers. The cell bodies of the general somatic afferent fibers are located here within the dorsal root ganglion. These neurons are considered to be pseudo-unipolar in morphology. That means they have a very long peripheral process that extends from the skin, for example, back to the cell body located within the dorsal root ganglion. They also have a very short central process, extending from the cell body to the neurons housed within the dorsal horn of the spinal cord. Once communication is made with the cell bodies in the dorsal horn of the spinal cord, then the signal is transmitted to the brain for interpretation, or there can also be interconnections with neighboring interneurons to form a reflex arc within the spinal cord itself. General somatic efferent fibers, on the other hand, are motor neurons. These fibers transmit impulses from the spinal cord to skeletal muscle, which is voluntary. The cell bodies of GSE fibers originate within the ventral horn of the spinal cord. These neurons have a very long axon that is sent out through the ventral roots and through the spinal nerves to eventually reach their target tissues, which in this case would be skeletal muscle. The axons of some of these general somatic efferent fibers can be 3 feet in length or more, especially when you're talking about axons that need to innervate muscles in the sole of the foot. Now that you have an appreciation for the two fiber types of the somatic system, let's now look at the visceral system. It is this system that contains the autonomic fibers, divided into sympathetic and parasympathetic fibers. The word viscera means organ, so the fibers discussed here will be transmitting information to and from the organs themselves. General visceral afferent fibers will transmit information such as pain from the internal organs back to the central nervous system. These neurons are considered to be pseudo-unipolar, meaning they have a long peripheral process, a cell body housed within a dorsal root ganglion, and a much shorter central process. And the central process will again communicate with the neurons in the dorsal horn of the spinal cord. General visceral afferent fibers, in addition to conveying information about pain, will also convey information about blood gas levels, blood pressure levels, and vascular distension. The main focus of the remainder of this video will be on the general visceral efferent fibers. These are the motor neurons of the autonomic nervous system, which transmits impulses to smooth muscle, cardiac muscle, and glandular tissue. General visceral efferents are further divided into sympathetic fibers and parasympathetic fibers. As a reminder, the cell bodies of the general somatic efferent fibers were housed in the ventral horn of the spinal cord. In contrast, the cell bodies of the GVE fibers are instead housed in the lateral horn of the spinal cord. These autonomic neurons will send out their axons through the ventral root into the spinal nerves, and they will be destined for their target tissues, which again is made up of smooth muscle, cardiac muscle, as well as glandular tissue. Recognize that somatic motor neurons rely on a single neuron to carry information from the spinal cord to a target tissue. The axons of these neurons could be more than 3 feet in length, especially in the instance of motor fibers innervating the muscles of the sole of the foot. The autonomic nervous system, however, uses a 2-neuron chain system. This series of 2 multipolar neurons is made up of a presynaptic neuron, also referred to as a preganglionic neuron, which has its cell body located in the lateral horn of the spinal cord. It's also made up of a postganglionic or postsynaptic neuron with its cell body located within an autonomic ganglion somewhere outside of the central nervous system. At the synapse between the pre- and postganglionic neurons, both the sympathetic and parasympathetic neurons release the neurotransmitter acetylcholine, which will propagate the signal to the postsynaptic neuron. However, between the postganglionic neuron and the effector tissue, the sympathetic division will release the neurotransmitter norepinephrine, which activates adrenergic receptors. On the other hand, the parasympathetic division continues to release the neurotransmitter acetylcholine in order to either stimulate or inhibit the effector tissue. Now, of course, there is always an exception to the general rule. In this case, the exception is sweat glands. Even though sweat glands are innervated by sympathetic neurons, they are stimulated by the release of acetylcholine instead of the release of norepinephrine. The second exception are chromaffin cells of the adrenal medulla. These cells are activated by acetylcholine, and once activated, they release either norepinephrine or epinephrine directly into the bloodstream, which can have systemic effects throughout the body. Now let's take a look at the sympathetic division and how it innervates the thorax specifically. So if the cell bodies of the preganglionic sympathetic neurons live within the lateral horn of the spinal cord, then where are the autonomic ganglia located that house the cell bodies of the postsynaptic sympathetic neurons? Well, for the sympathetic division, there are a series of paravertebral ganglia that make up the sympathetic chain, also called the sympathetic trunk, which runs in parallel to the vertebral column. This paired chain is quite long as it extends from the neck all the way down to the sacrum. In addition, synapses can also occur in what are known as prevertebral ganglia. So what's the difference between paravertebral ganglia and prevertebral ganglia? Well, let me remind you that the prefix para means alongside. So the paravertebral ganglia live alongside the vertebral column, whereas the prevertebral ganglia are positioned in front of the vertebral column. Now, personally, I prefer the term pre-aortic ganglia because it's more specific. These ganglia are located within the abdomen, just in front of the aorta itself. And as you will learn in just a moment, there are nerves referred to as splanchnic nerves that will carry preganglionic sympathetic fibers down to these prevertebral or pre-aortic ganglia in order for the synapses to occur within these ganglia. In total, there are 22 to 23 pairs of paravertebral ganglia that form the sympathetic chain. There are 3 cervical ganglia in the neck, 12 thoracic ganglia, 4 in the lumbar region, and another 4 to 5 in the sacral region. What is interesting about this information highway is that there are only 14 on-ramps. We'll call these on-ramps white rami communicans. That is, the only way for presynaptic sympathetic fibers to get onto the sympathetic chain is through the white rami communicans that communicate with spinal nerves T1 through L2. Because all sympathetic fibers originate from T1 through L2, the sympathetic division is referred to as the thoracolumbar division, because the fibers originate from the thoracic and lumbar spinal levels. The functions of the sympathetic system that are listed here on this slide to the right are in regards to the organs of the thorax only. As we progress throughout the other body regions, autonomics will come up time and time again. For now, you're only responsible for the autonomics that affect the thorax. Realize that the sympathetic division is the fight and flight division. Picture yourself in a dark alley being chased by a perpetrator. To flee from this perpetrator, what do you need to do? You'll need to increase blood flow to your lower limbs. And to accomplish that, your heart rate and blood pressure will have to increase. The blood flow to the heart will increase so that it can keep up with the demand. And to get more oxygen to your muscles, your breathing rate and depth of respiration will increase as well. In addition, bronchodilation will occur to increase the volume of gas exchange in the lungs. By remembering this simple example, it will help you to remember the key stimulatory effects that sympathetics have on both the heart and the lungs. Before we take a look at the actual pathway these sympathetic fibers take to reach their target tissues, I want to make sure you have a clear understanding of the structure shown here in this image. Let's start by taking a look at the dorsal versus the ventral rootlets. Once the dorsal and ventral rootlets unite, they form their respective roots. So here, the dorsal rootlets are uniting to form a dorsal root. Likewise, when the ventral rootlets converge, they form a ventral root. Sometimes the dorsal and ventral roots are referred to as posterior and anterior roots. Either terminology is fine. Once the dorsal and ventral roots unite, they form a very short spinal nerve. The spinal nerve quickly divides into a larger ventral ramus and a much smaller dorsal ramus. Now let me remind you of the fiber types conveyed through each of these nerves. The dorsal root is considered the sensory limb, if you will, because it only conveys sensory fibers. In other words, it only conveys general somatic afferents and general visceral afferent fibers. Whereas the ventral root would be considered the motor limb because it conveys general somatic efferent fibers as well as general visceral efferent fibers. When the dorsal and ventral roots unite to form the spinal nerve would therefore contain all four fiber types. As such, we'll consider the spinal nerve to be a mixed nerve. Likewise, because the dorsal and ventral rami are distal to the spinal nerve, they too would contain all four fiber types, so they as well are mixed. As I mentioned a moment ago, there are 14 on-ramps that allow the preganglionic sympathetic fibers to enter the sympathetic chain from levels T1 through L2. The 14 different on-ramps are called the white rami communicans, again entering the chain from ventral rami T1 through L2. They are called white rami communicans because their fibers are myelinated, giving them a white appearance histologically. For the purposes of our analogy, we'll consider the gray rami communicans to be the off-ramps. These communicans are unmyelinated, giving them a gray appearance histologically, hence their name. Let me also mention that all ventral rami of spinal nerves have gray rami communicans connecting them with the sympathetic chain directly, whereas the white rami communicans again are only connected through T1, L2. Once the preganglionic sympathetic fibers have made their way onto the sympathetic chain via those white rami communicans, There are three different things that can happen from here. The first option is that a preganglionic neuron can synapse with a postganglionic neuron in a sympathetic ganglion at the same level. Let's take a look at this example. Here is a cell body of a preganglionic sympathetic neuron. It's sending out its axon through the ventral rootlets and ventral root, onto the spinal nerve, and finally onto the white rami communicans to enter the sympathetic chain. Once in the sympathetic chain, the synapse occurs at the same level. Here's the synapse, and after the synapse, the postganglionic fiber is sent out through the gray rami communicans, and it enters into the ventral ramus. This is the gray rami communicans. And this is the ventral ramus. Once in the ventral ramus, the postganglionic fiber is conveyed to the target tissue. The second option is for the preganglionic sympathetic fiber to enter the sympathetic chain and then either ascend or descend to a different ganglion within the chain. Here again is the cell body of the preganglionic sympathetic neuron. The axon is sent out through the ventral rootlets and ventral root onto the spinal nerve and enters the sympathetic chain via the white rami communicans. Once within the sympathetic chain, then the preganglionic fiber can either ascend or descend within the chain to another level. In this instance, we're ascending to the level above. At this level above, the synapse occurs within this ganglion, and the postganglionic fiber is sent out through the gray rami communicans and enters into the gray ramus. And from there, it again will innervate its target tissue. Here's the third option. In this option, the preganglionic neuron enters the sympathetic chain, but it doesn't synapse at all. Instead, it goes through the paravertebral ganglion and it exits the chain via a back door, which we'll call a splanchnic nerve. Let's take a look at this example. Here again is the cell body of a preganglionic sympathetic fiber that is residing within the lateral horn of the spinal cord. The axon is sent out through the ventral rootlets onto the ventral root, onto the spinal nerve, onto the white rami communicans, and once inside the sympathetic chain, no synapse occurs whatsoever. Instead, the preganglionic fiber exits through the back door of the splanchnic nerve in order to make its way to a prevertebral ganglion. Remember, those ganglia were also called pre-aortic ganglia. Once inside the pre-aortic ganglia within the abdomen, the synapse occurs, and from there, the postganglionic fiber can be carried to its target tissue. So the next question is, where exactly do these splanchnic nerves go? Well, again, these splanchnic nerves are going to be headed to the abdomen so that synapses can occur within those pre-aortic ganglia. There are a number of different types of splanchnic nerves. The lower thoracic splanchnic nerves specifically are going to emerge from the sympathetic chain and will carry the preganglionic sympathetic fibers to the ganglia located in the abdomen, which again are the pre-aortic ganglia. The three lower thoracic splanchnic nerves are the greater, the lesser, and the least. The greater thoracic splanchnic nerve happens to come from levels T5 through T9, and here's the greater splanchnic nerve shown here on the image. Lower down within the thoracic cavity, you have the lesser thoracic splanchnic nerve, which comes from the levels T10 through T11, and the last splanchnic nerve to arise from the thoracic cavity would be the least splanchnic nerve, which comes from the level of T12. I'll mention this now, but we'll come back to it in a moment. There are also something called cardiopulmonary splanchnic nerves, which originate from T1 through T4, and they're going to be responsible for innervating the thoracic viscera, specifically the lungs and the heart, via the cardiac plexus. We'll see a better example of these nerves in just a moment. For now, let's continue on with the story of these three splanchnic nerves, the greater, the lesser, and the least. For the sake of completeness, there are four main prevertebral ganglia located in the abdomen. Again, these are also referred to as pre-aortic ganglia because of their position just in front of the aorta. The four ganglia include the celiac ganglion, which is located at the pedicle of the celiac trunk. You also have the superior mesenteric ganglion located at the origin of the superior mesenteric artery. The aortorenal ganglion is located at the armpit of the renal artery and the aorta, and then the inferior mesenteric ganglion is at the pedicle of the inferior mesenteric artery. For now, all I want you to appreciate is that those splenic nerves from the thorax are coming down into the abdomen, into these specific ganglia. In general, the greater splenic nerve will come down to synapse within the celiac ganglion. The lesser splenic nerve will come down to synapse in the aortical-renal ganglion, and then the renal ganglia will receive the synapses for the least splenic nerve. The renal ganglia tend to be closer to the kidneys themselves. There are lumbar splenic nerves within the abdomen. We're not going to worry about those just yet. And then also recognize that the superior mesenteric ganglion will receive a combination usually from the greater and the lesser splenic nerves. Now let's take a look at the parasympathetic innervation of the thorax. Whatever the effects the sympathetic fibers have on a tissue, parasympathetic fibers tend to have the opposite effect. In the thorax, for example, sympathetic fibers increase heart rate, breathing, and the force of ventricular contractions. Since the parasympathetic system is the rest and digest system, which is an anabolic system that conserves energy, it is largely responsible for bringing tissues back to baseline after sympathetic stimulation. Parasympathetics are also going to regulate the digestive process, including peristalsis and salivary gland secretions. Unlike the sympathetic division, which originated from T1 through L2, the parasympathetic division is referred to as the craniosacral division because it entails cranial nerves and sacral nerves, specifically sacral nerves from S2, S3, and S4. In the head, there are 4 parasympathetic ganglia where the synapses between pre- and postganglionic parasympathetic neurons occurs. For now, don't worry about these, because when we get to the head, you'll learn all about them. However, within the thorax, abdomen, and pelvis, the preganglionic parasympathetic fibers synapse with postganglionic fibers within intrinsic or enteric ganglia, such as Auerbach's or Meissner's plexus. These ganglia are located within the walls of the target tissues themselves, as shown here. This means that preganglionic parasympathetic fibers coming from the brainstem, for example, can be very, very long, whereas the postganglionic parasympathetic fibers are very, very short. One example of a parasympathetic nerve is cranial nerve number 10, the vagus nerve. Within the thorax, the vagus nerve passes posterior to the root of the lung, and it contributes to the esophageal plexus as well as the cardiac and the pulmonary plexus. The vagus nerve carries preganglionic parasympathetic fibers to its target tissues. In the case of the esophageal plexus specifically, the vagus nerve gives off a number of small branches that innervate the smooth muscle of the esophagus to stimulate peristalsis and to stimulate mucus gland secretions within the esophageal mucosa. As we've already described, after the vagus nerve gives off the esophageal plexus, the continuation of the vagus nerve is referred to as the anterior vagal trunk. Specifically, the left vagus nerve rotates toward the anterior surface of the esophagus, whereas the right vagus nerve rotates around the posterior surface of the esophagus. Therefore, the right vagus nerve will become the posterior vagal trunk. Sympathetic innervation is also going to be carried to this esophageal plexus from, of course, the sympathetic chain. The purpose of that innervation is to supply the esophageal vessels. The esophageal plexus will also contain general visceral afferent fibers, which will convey information about visceral pain. So in general, remember that autonomic plexuses contain both sympathetic fibers, parasympathetic fibers, and general visceral afferent fibers. The parasympathetic fibers of the pulmonary and cardiac plexuses also arise from the vagus nerve. Parasympathetics of the pulmonary plexus are responsible for decreasing breathing rate and decreasing the depth of respiration. They are also responsible for bronchoconstriction. Parasympathetics carried through the vagus nerve also stimulate the secretion of glands in the bronchial tree. Fibers that are being conveyed from the sympathetic chain will provide sympathetic innervation to the pulmonary plexus. Within the pulmonary plexus, sympathetics are responsible for increasing the breathing rate and depth of respiration. They will cause bronchodilation. Sympathetics will also constrict pulmonary vessels to enhance gas exchange at the arterial level. And lastly, sympathetics will inhibit secretions of glands within the bronchial tree. Just like the esophageal and pulmonary plexuses, so too is the cardiac plexus made up of both sympathetic and parasympathetic fibers. If you stood up and performed 20 jumping jacks, the sympathetic nervous system would signal your heart to speed up by stimulating the SA and AV nodes. In addition, the coronary blood flow to the heart would be increased, and the force of ventricular contractions would also increase to keep up with the demand. I've included this image to point out that the cardiac nerves, which are innervating the cardiac plexus, are coming from the ganglia within the neck. Let me draw in a few things to make this a little clearer. I'm going to draw in a sympathetic trunk. 1, 2, 3, 4 ganglia. This ganglion would represent T1, T2, T3, and the T4 ganglion of the sympathetic chain. The sympathetic chain continues north to be associated with the inferior cervical ganglion, the middle cervical ganglion, and lastly the superior cervical ganglion, which is the highest ganglion in the neck. Let me also artificially draw in a spinal cord. As preganglionic sympathetic fibers exit the spinal cord and make their way onto the sympathetic chain, they will rise within the sympathetic chain all the way up to the superior cervical ganglion. And once there, the synapse can occur between the pre- and postganglionic fibers. After the synapse has occurred, the postganglionic fibers can redescend through the superior cardiac splenic nerve in order to innervate the cardiac plexus. Notice that there are also middle and inferior cardiac nerves, which would also be conveying postganglionic sympathetic fibers back down to the cardiac plexus. Collectively, we tend to refer to these nerves, the superior, middle, and inferior cardiac nerves, as the cardiopulmonary splenic nerves. And just as a reminder, the cardiac plexus, as shown on the previous slide, is also going to contain parasympathetics, which will be conveyed through the vagus nerve. The vagus nerve will be responsible for overriding the SA and AV nodes, thereby slowing down the heart rate and reducing the force of ventricular contractions. And just like the other plexuses contain general visceral afferent fibers, so too does the cardiac plexus.